Maybe you've heard about the concierge medical model, the traditional medical model, and this direct primary care model, the fee-for-service model. You've heard about all of this, and you're sort of still confused and trying to decide what's the right model for your medical practice that you're planning on creating. So in this video, that's what we're going to go over. So you're likely quite familiar with the traditional healthcare model in the US, where you're paying monthly premiums for health insurance, and you go into a clinic, they're going to bill your insurance as long as they accept your insurance. That's kind of the traditional practice. Now, right below that is the kind of fee for service, assuming it's a cash-based model. You go to a clinic, you're between insurances, you don't have insurance at this time, and you're going to pay them cash. You're going to pay them $300 for a specialty visit, or $800. You're going to pay $150 for a primary care visit, and you might pay $200 to go to an urgent care. That's kind of the fee-for-service, cash-based model. So maybe some newer concepts that are out there. Let's talk about concierge first, because that's been around for a very long time. The concierge model is usually a hybrid, meaning you're either doing insurance and you're charging somebody a fee every month or every year just to be part of your practice, or it's a cash-based model and you're still charging that fee. So think of this fee as kind of the membership fee, kind of a participation fee. So just to be in my practice, you have to pay a certain amount. Another way to describe it is, here is a physician who's got a panel of 1,500 patients. Now, he or she doesn't want to have a panel of 3,000. So the way she's going to limit it is, say, the first 1,500 people who are willing to pay me $5,000 a year are going to be able to partake in my practice. You still need to have insurance because I'm going to bill your insurance. And the final one, number 4, is the direct primary care or direct specialty care, whatever you like, where you're paying just a monthly fee. It's usually very low and affordable, and you are then able to have access to this clinic. So think of being a autoimmune patient, you're a GI patient, you have a lot of chronic GI issues, chronic autoimmune issues, or just primary care, right? And you're going to want access to that physician constantly, or regularly, not constantly. So you're going to pay a certain amount every month, and you get to go see that physician regularly. So for example, direct primary care usually is around $100 to $150 a month. Direct specialty care might be around $200 to $250 a month. And paying that monthly fee ensures that the doctor is going to have a regular source of income, and they're going to have a regular follow-up with you so that they know that your care is going to be good in the long run. Now, I should mention that all of these are all over the place when it comes to pricing. Even when we look at the traditional health insurance, if I take an HMO, I can now compare it to a PPO, where a PPO might be 3 times the amount, maybe even many, many times over if the PPO decides to really bill for everything and send me for every type of test, kind of like almost concierge level. In the concierge, in the fee-for-service model, you can go and go to an urgent care that's $99 for a visit. You can go to an urgent care that might be $299 for a visit. My partner went to a sports medicine doctor for $900 for one visit, and I went to a hand surgeon for $150 for one visit. Both of these were at major medical institutions in California, in Southern California. Just the way it is. It's just different price points. And of course, you can see that in the concierge models beautifully. Somebody's going to charge you 150 models. I think One Medical is kind of like that, where they're just charging like $200 a year. I have no idea, but it's kind of a concierge model, or One Medical was a concierge model. And there are many other types similar to that, where they charge you a certain amount. That's very low, seemingly, and there are some where it's $150,000 a year just to be part of this practice, and to have the luxury of being able to connect with this doctor when they have an appointment. There's no guarantee still when you're going to get the appointment. Of course, it's much more concierge than you think. And I would say even the DPC space is kind of unique in that you don't know what's actually covered in the DPC. Some people will have a very low fee, $75 a month. Some people will have a $300 a month for primary care, but that might include all the tests and everything that you need. So now we kind of go down into the juicy part of it. How do you decide between a traditional practice or a concierge practice? Or how can we say, let's say, how do you decide between a traditional practice and a non-traditional model? The nice thing about the traditional model is that it is fairly easy to figure out. It's fairly well established, a concept, right? You need a billing department, you need contracts with insurance companies, you're gonna see the patient, you're gonna try to do the maximum amount of billing for that patient, submit it to the insurance company, get the money from Medicaid, Medicare, and commercial insurers. Of course, you're going to need a fairly decent staff to make sure that everything is done, send prior authorizations, check the patient in, do the things that the insurance company demands of you, submit the documents, and the billing department usually will handle that. Sometimes your software can handle that. And you have to give a timely amount of access to the patients with the insurance companies that you contract with. So it's a bit of a high overhead practice. I would say for general primary care, you're looking at 2 to 3 employees minimum. You're looking at quite a bit of overhead for your CPA and your billing department and your electronic health record, etc. So maybe shifting gears to the concierge model. Actually, I'll say one thing about the traditional model. The nice thing about the traditional model is there are millions of people waiting to come see you. If you open a traditional insurance-based practice, the insurance companies will send you a horde of patients. A church of patients are going to be knocking down your door. Why? Because it's in high demand. It's the most common model, and it's a model that's in highest demand right now. It's what patients want. Is it good? Is it bad? That's a whole different discussion. So when it comes to the concierge model, I think the difficulty with that is, number one, the client base is different, so the expectations are different. Number two, it's more of a service model, and I'll get into that in a second. And number three, the overhead is often bigger. So if you build a concierge model, it's less likely that people are going to find you or have enough faith in you if you are off the beaten path in a industrial space. They're going to want you to be in a little bit of a sexier, chic space. So that's kind of the overhead part. Maybe when you hire a physician assistant or a nurse practitioner, a medical assistant, anybody, those people are going to have to be a little bit more refined. That means you're going to hire the people who are a little bit better. You're going to have to pay more for that. So the overhead can go up in order for you to offer a good service to these individuals. And what do I mean by service? They may want to text, call, show up, and they're going to want this test, that test. They're going to want you to do some of that work to arrange it for them. Obviously, somebody who's coming into a concierge practice is going to expect that the service is better than their traditional insurance model, because they still have insurance. They probably have a PPO. So they can go to any clinic. You don't want them to go to UCLA and UCSD. You want them to come to you because your office will arrange everything. That's just a little bit more moving parts. By no means difficult. Doctors in traditional medical practices do much more than that, but it is a different model. It's something you have to learn, right? And the client base is different, meaning the people might be, not at all for sure, but they might be the worried well, they might be the people who are after kind of longevity. They're the ones who want the newest technology. They want to do these new tests that come out on the market. They're going to ask you questions about, the newest biologics, the newest supplements, the newest testing. And that can get a little bit overwhelming because that might become a big part of your practice. So kind of pleasing that client base, who may not have a lot wrong with them, but might have a lot of expectations, can sometimes wear you down, or it may not. For me, the beauty of concierge practice is that it is something that can naturally evolve from a traditional insurance practice. What I mean by that is, if you open a traditional insurance-based medical practice, let's say even here in Long Beach, I live in Long Beach, California. If I open one, maybe in the northern part of Long Beach, and Signal Hill, for example, is a good area, or further east is really good. People with plenty of money probably have good insurance. If that practice takes off and people like me and they want to come see me, slowly I can offer or roll out a concierge practice. Of course, I can also slowly roll out a DPC practice and say, hey, look guys, I don't even take any insurance anymore. So that's that's what I like about the concierge model and the DPC model. You can definitely start a concierge and DPC model without ever having had a practice before. That you can even do a completely virtual one. But of course, there's more marketing, there's more effort. Anytime you go in an insurance-based model, the patients are there, they're waiting. That's what you're essentially, that's why there's not a lot of private practice doctors who take cash, because finding your own patients is complicated. Not impossible, definitely not difficult, but it is complicated. So leave some comments below. I would love to hear what your thoughts are about starting a practice, whether what you've been considering, what is your preference and why? Why do you think a traditional model is better for you? Why a fee-for-service model? Why cash? Why insurance? I'd love to hear it. Check out digitalnomadphysician.com. Take care, guys.